Barbie Schimke, and I'm a A1 nurse. I'm involved with my nursing association, which is Association of Women's Health and Obstetrics and Neonatal Nursing. I do work at HonorHealth. I'm a full-time mom, part-time nurse. I do work nights, and part of that involvement for me is to get involved because we try to do a lot of education and teaching, and nighttime right after you have a baby isn't the best time. Moms and parents are very tired, and there's a lot to go over, so participating in events such as this, the 4th trimester, where we can talk about it before or perhaps just after having baby when you're a little bit more prepared for teaching and learning is the point, and that's why I'm here. I have no disclosures, nothing to, not selling any products or anything, just educating. So if you don't have any other takeaway from this session, it is that it takes about a year to make a baby, and you're at risk for postpartum complications about a year after having baby. Your body is not Amazon. You can't get what you want in 2 days. All right, so this is to review what's normal versus when you should call and get help. So I've got the dad there with his cell phone. So, this is for not just for the moms to learn about the complications that they might face, but also for the dads who are there. Mom's focus after she has the baby is the baby. And so the dad that's there supporting the mom, or maybe it's your mom or your mother-in-law, the new grandmas, or perhaps a sister. So this is for anybody who is going to be involved with that new life that's here now. This is the form that my nursing association has put together and that we are using for our discharge information, discharge education. We're trying to get this out. Your discharge nurse should be reviewing it with you. My idea is that each nurse should be going over it, because if you're there 2 days, or maybe you have surgery and you're there 4 days, if each nurse talks to you about it, that's anywhere between 3 and 8 nurses that should have reviewed this with you. We'll break this down into each component here, and I believe that they passed it out and it's in your bag too. So the important part is, I had a baby on, and what am I having? So if you do need to call 911, you're going to let them know, I just had a baby, the baby's date of birth, and then what symptom you're having. So yeah, what do I say? Let's move on. So call 911 if you have chest pain or shortness of breath. One of the first signs of a pulmonary embolism or a blood clot in the lungs is shortness of breath. So if you're sitting on the couch nursing the baby or feeding the baby, you shouldn't have a hard time catching your breath. Like, you shouldn't be feeling discomfort in your chest. And if you have that, that is a reason to call 911. You can always call and they can do a visit, and you don't have to be taken to the hospital. They'll do what they call a well check. And then, so it's better safe than sorry is what I'm getting at. So if you climb a flight of stairs, I expect you to be winded. You're exerting yourself. But if you're on the couch feeding the baby, you shouldn't have any of those symptoms. I guess you have to point it at the screen there. So call 911, obviously, if somebody experiences a seizure. I feel like that's pretty duh. If the postpartum woman experiences a seizure, it may mean you have a condition called eclampsia. I know they mentioned earlier eclampsia, preeclampsia. You can have post-eclampsia. You can have high blood pressures. 6 weeks after is how long it takes for blood pressures to re-regulate themselves. So preeclampsia is a disorder of pregnancy in which there is high blood pressure, either large amounts of protein in the urine or other organ dysfunction. You probably are familiar with the OB visits. You go and you give them a sample. They take your vital signs, blood pressures, etc. So that can happen before or after. Thoughts of hurting yourself or the baby. So this, there's a lot of concern and talk about maternal mental health, and actually I'm involved with the March of Dimes, and we went to Lobby Day, and we're talking to our representatives about getting more care for maternal mental health. This is just a difference that talks about between baby blues, which is considered normal. It usually resolves within 2 weeks. Hormonal, like we were talking about earlier. Crying for no reason, sadness, poor concentration, irritable, restless. But if you were surviving off of a couple hours of sleep, you'd probably have those symptoms too. A sign of depression would be lasting longer than 2 weeks, anxiety, guilt, suicidal thoughts, thinking that everyone might be better off without you, appetite changes. So if you're experiencing any of those thoughts, that's when it's time to talk to somebody. Might be a difficult conversation to have, but it's, again, better safe than sorry. Postpartum psychosis, I'm not going to go into that here, but that's the failure to identify reality versus what you have going on in your head. That's very dangerous. You want to call 911 for thoughts of hurting yourself or the baby. Little side note here, baby blues can return again when you wean from breastfeeding, and again when you get your first period back. That's one of those little tidbits I'm like, I wish someone had told me. I didn't know that. Things that we don't talk about at the baby shower. Yeah, hormones. Yep. Dads can also get postpartum depression. Not sure if anybody knew that. So they see their wife struggling, they might be struggling, trying to find out what their role in all of this is. Mom might be breastfeeding, so he's not sure how he can help. Or maybe mom had a very scary, they were talking about PTSD earlier, maybe they had a traumatic delivery. 30-some% of families talk about their delivery experience as traumatic. It could be an emergency C-section, or maybe mom's blood pressures were high. Maybe they were planning on breastfeeding and baby's a little early and not a good breastfeeder. There are lots of different reasons, but dad can, they can get postpartum depression too. So, same with asking the mom to reach out and talk to somebody. It might be good for dad to reach out and talk to somebody as well. Oh, hold on. Let me go back one more. Dads display it different. Men hold their stress and their depression differently than a woman does. So they get headaches or stomach issues or pain. So they might not feel sad or be crying about it, but they might be having this, nagging headache. So that's a sign if you're noticing that. It might be caffeine. A lot of times they'll be like, oh, are you a regular caffeine drinker? Are you hydrated? Are you eating? But if you're carrying those headaches, it might be something else going on. So call your OB or go to urgent care if you bleed through a pad in an hour. So we try to discuss this at the hospital. When my patient is there and I go and I assess her and I listen to her heart and lungs, and then I'm feeling her fundus or the uterus now that the baby's out. And then, if you have that, you call me. But when you go home, you would want to call your OB. So how much bleeding is normal. If you bleed through a pad in an hour, that is not normal. That is too much. You want to call and let your OB know. If you pass any clots that are golf ball size or egg size or larger, that's the other sign that you need to call. Little things, grape, cherry tomato, those are normal. And so that doesn't need, somebody asked me, do I need to save it? Should I text them a picture? No, we're gross at the hospital. We'll measure it. We like numbers. Doctors respond to numbers. So if we measure it and we tell them she passed a clot, it was this much in blood, that gives them a very precise measurement. But if you're at home, you just need to call and tell them, hey, this is happening. The next one. So this is kind of a quick reference for the nurses at the hospital, how much, kind of in that milliliters frame. So the bottom's cut off there, but that's up to 80 milliliters, which at that point we're getting kind of significant in an hour. So call or go to urgent care if you have an incision that's not healing. So my C-section patients, I usually tell them, you might not be able to see it because you still have a bit of a belly there, right? So you are probably going to notice it on your clothing. So a lot of doctors are closing now with Dermabond. So you shouldn't have it sealed because it's skin glue. So you shouldn't have any drainage on your underwear or on your clothing. If you do, then that could be a sign that there's something going on with that incision. Any redness, like a sunburn or like warmth, heat, is usually a sign of infection. Obviously, any drainage or pus is a sign of infection. It could also be for discharge, like on your pad. So if you have to have if you've had a laceration or an episiotomy, which most of them are steering kind of away from that. But if something happens and you have to have one, you shouldn't have any like foul smelling discharge or weird colors on the pads. It should get lighter, kind of like period bleeding. It will start red and then kind of get lighter and kind of turn that light brown, kind of like a period ending. Next one. So I get asked this all the time about swelling in the legs. So after you're in that third trimester and you're on a feed a lot, all that fluid in the belly, gravity works, it ends up in your feet. So if you elevate them, that'll help reduce that swelling in the legs. That can happen still for 2 weeks after having a baby, and that's considered normal. If you're feeling good a few days after you go home and you're feeling good, maybe you do a load of laundry and you're on your feet a lot that day, and then at the end of the day you're like, oh man, what's going on down here? That is your body's way of saying, look, you just had a baby, take it easy, put your feet up. But if one side's more swollen, again, that redness, hot like a sunburn, then that could be a sign of a clot in that leg. It's going to get more swollen and painful. A lot of times it's in the back of the calf. So if that happens, that could be a sign. And I know nobody wants to take their baby to urgent care. So, with the exposure, if somebody can stay home with baby and somebody can take you to get checked out, that would be the safest. But if you have to, you have to do what you have to do to get that checked out. Call your OB's office. There's always somebody at the OB's office to answer your questions, either like a med tech or like a nurse practitioner or somebody you can leave a message with, and your OB's office should be able to get back to you. So call your OB or go to urgent care if you have a temperature greater than 100.4. That's the same for mom or baby, a temperature greater than 100.4. The concern is infection. This is very rare, septic pelvic thrombophlebitis. So that's tiny blood clots that are infected. That doesn't go away with antibiotic treatment. So then that might cue them in that this is going on, but that's very rare. Flu-like symptoms. So then we're concerned about mastitis. So if you're having those fevers and you have flu-like symptoms and you're breastfeeding, then that could be a sign if you have redness or pain. It takes 3 to 5 days for your milk to come in. So if you're having engorgement problems and then you have these other symptoms, then it might be mastitis, and that's something to call the OB's office for. Headache or vision changes. So then again, we're concerned about the high blood pressure, the post-birth preeclampsia or post-birth eclampsia. So if you have any headaches that don't go away with some Tylenol or some Motrin, then that's when it's time to call your OB. So I'm just wondering if we start putting these things in the dish, in the baby shower gift, if that might help save a life, spark a conversation. So I actually did that for my sister-in-laws. I gave her a robe and a little matching baby swaddle, and I was like, I'm just going to tuck this in here too, because the nurse in me is like, we need to have this conversation, and I feel like right after you have the baby and you're in the hospital and you're trying to get some sleep, it's really not the time for me to be yapping at you. These are my references that I used, and then I have time for questions. Sure. Yes, so I wanted to kind of go into breastfeeding on here, but we decided to focus it mostly on just the post-birth warning signs. But women do experience letdown differently than each other. Some of them don't feel anything at all. Some of them do feel like a tingling sensation or like pins and needles. I haven't had anyone express it as like a shortness of breath, but chest pain is like an elephant sitting on your chest. So I hope no one is experiencing letdown that way, because then that's, we're talking pain versus like a tingling sensation or pins and needles. Does that answer your question? Okay. Are there any other questions? Okay, so then I get to talk to you about the lobby day that I went to. So for March of Dimes, I went to lobby day this year and last year and talked to the representatives. And then I got asked if I wanted to testify to be on the maternal morbidity and mortality. So that's my whole role in this, is that I'm a nurse and I want to educate and try to save moms' lives, because you've probably heard in the news that the maternal morbidity and mortality rates are really high in the United States right now. And I thought, well, how can I get involved and what can I do? And I got asked to testify, and I thought, this is too important not to. So I said, I have no idea what that means. Let's go testify. What is that? So you go, and we went to the House of Representatives, or the House, and so we went and we basically told them why we need to have this committee to collect this information, because no matter where you have a baby, if it's in a hospital, a birthing center, a home birth, Arizona collects that information, and they have all the statistics, but nobody's reviewing or doing anything with it. So that's the problem. They did pass last year for a committee to be formed, and so they're going to review that information and see where the disparities are. Like, for women of color, for our Navajo Nation, for, where are those disparities? What can we be doing? Do we need to be educating better on our post-birth warning signs? Do we need to say, when to get help? Do we, what is it? So we're going to review that. We have a committee, and they're meeting, and they're bringing the community in, which I love, and events like this, the 4th trimester, where we can all talk and all collaborate and find out for our community personally here in Arizona. So that's my role in this. I talk really fast, and that was my presentation. So if you have any other questions, I'd be happy to answer them. Otherwise, I do want to release you to go out and check out the vendor tables. So thank you.